Hey everyone, thank you all again for being here. This time as a presenter, I want to thank you for your attention and for listening to me talk about my blood, sweat, and tears. I did the MSc in Organizational and Social Psychology. My project is titled Peering Through the Glass Door, Unobtrusively Analyzing Negative Employee Feedback to Aid Organizational Learning. It was supervised by Dr. Tom Reeder. So my project was inspired by an irony of learning in organizations. So the literature has long acknowledged that it is valuable for organizations to listen to their employees and to learn from errors, particularly in high-risk organizations such as healthcare and aviation. And yet, in these organizations, employees are discouraged to speak up and often face negative consequences for speaking up. So then how does the organization learn? And a particularly disturbing empirical consequence was the 400 to 1,200 avoidable deaths that occurred at Stafford Hospital, so one of the NHS's hospitals, a few years ago, where the reason the deaths were considered avoidable is because they could have easily been prevented if the hospital was listening to the complaints that were constantly being raised by patients, their families, and by the employees of the NHS. So in order to address this problem, well, we thought, okay, if employees aren't speaking up in the organization, well, maybe they're speaking up elsewhere. And this elsewhere is what we operationalized as Glassdoor. So Glassdoor is an employee review website. This is just an illustration of one of the reviews left by an NHS employee, so a doctor, as it says in the title. And they appraise the organization both qualitatively and quantitatively. So they have scales where they rate the organization from 1 to 5 for, say, work-life balance. And then they also write in more qualitative information like pros, cons, and advice to management. And since we're more interested in complaints, so when people actually raise negative information about the organization is when it can actually learn from them. So in my research, I analyzed 514 of the Glassdoor reviews, so particularly the cons and the advice to management. And I did this through 2 studies. So in the first study, I used a patient complaints analytic framework called the Healthcare Complaints Analysis Tool, developed by Tom Reeder and Alex Gillespie. And I tried to deductively, I did a deductive content analysis, but then I found that employees were raising different things than patients were, and so the first framework was not as comprehensive. And I did a second study then where I inductively built a framework that was bespoke to the data that was at hand. So I called this the Employee Complaints Analysis Tool because I'm very original like that. So this is kind of snippets of the 2 coding frameworks. So that was from the paper that I used for the HCAP framework. And this is kind of a part of the framework that I built for my own data. So I did have a lot of other findings apart from this, but I'm just going to focus on this because it's what I used for my interpretation in my discussion section. And so the top 4 problem category level issues that were raised were institutional processes, environment, staff physical, psychological problems, and respect and rights. So I thought that, well, it's all well and good if the NHS knows the kind of problems that are occurring, but, well, what do they do about it? And can we kind of use this data to take it back to the theory and interpret the findings that makes it more meaningful for the organization to address these problems? So I did 2 kinds of interpretive analyses, which I recognize now in retrospect might have been a bit much, but I looked at the top 4 problem categories and tried to see why they were all co-occurring. And it led me to some sociological literature. So Jürgen Habermas discusses this system-life-world tension, where the system is more of the institutional processes and the bureaucracy in the organization, and the life world is more of the social world of the employees. And kind of the data showed this cyclical pattern occurring where this pressure and this rise in institutional factors, things like understaffing and being under-resourced, actually leads to the more physical and psychological problems in the staff, which then just leads to poor patient safety and quality of care and precipitates this cycle further. And I had previously mentioned this, but the employee complaints data actually showed a lot of different things than the patient complaints data did. And this is actually something that I found was a strength in this research, just because I was able to find a human factors framework that James Reason developed that talks about, it's called the organization accident causation model. It's here, but I don't know if it's super, yeah, I can't even read that, so I don't know if you can. But basically, he discusses how there's latent failures that occur in the organization that develop over time and then lead to the more active failures, which leads to an accident or something even preventable. So the latent failures is something, so to give you an illustration, if a nurse prescribed the wrong dosage of medicine, that would be more of an active failure, and patients report on that readily because they're incentivized to do so, and they complain about something like that. So that's something that the organization learned on the active failure front. And the latent conditions are what the employees are reporting. So, you know, like I mentioned previously, understaffing, poor resources, which kind of leads to saying, hey, the nurse was dealing with 10 other patients at the same time and then prescribed the wrong dosage of medication because she just couldn't, he or he couldn't handle the workload. So together, you can kind of get a holistic understanding of why accidents happen. So if both the HCAT and the ECAT were used in tandem, you could help the organization get a fuller picture. And this is kind of my plug for the new MSCs, unobtrusive methods. They're great, use them. Use non-traditional data sources. So interviews and surveys are wonderful, but you always have to kind of understand why you're using the method you're using for your research question and for the context that you're interested in investigating. So Glassdoor was something that I had chanced upon and talked to Tom about, and I'm so happy that I did. So finally, why does it matter? The most obvious reason why it matters is we want to avoid avoidable deaths. And we can do so by just helping the organization learn. It also provides a tool for, well, this particular project provides a tool for constant monitoring and learning. The Glassdoor data is pretty much auto-populating, so I mean, there have already been about 500 new reviews since I finished this project. And lastly, methodological novelty. So this is me again going back to saying you can use data sources that aren't always something that you would think of as a source of data. So thank you all so much for your attention. My email is below and also in the leaflet, and I'd love to chat more after. Thank you.